Good evening.
Good evening.
Happy to hear you. I hope that you're okay. So we haven't seen each other almost 1 week. So I would like to know how are you, how was your weekend, and how is your new week? How do you feel? What's your mood? How is your mood? And so on. So let's start from Olena Kachanova. Say a few words, please.
I'm glad to listen to you because I had a problem to connect with English session. Unfortunately, it repeats everyone. I don't know. I don't understand. But I'm with you now, and I'm glad. About my weekend, I have a short holidays, and my husband and I visited his relatives, his sister in countryside. It wasn't interesting for everyone, but it very important for my husband because his sister is 89 years old. She is ill, and they were very close in childhood. So it was very important for him, and I suggested him in this travel. My husband's sister, her daughter, met us very good, and we відчували. We felt themselves very comfortable. Maybe it's all.
Okay, thank you for sharing your thoughts. Olena Kalinina.
Good evening. I'm glad to see you again. My mood is good. I have good holidays, very useful as for me, because in Saturday I went to nearest hospital and to meeting and visited day open doors. I look for job in this hospital. Now good weather, good mood, and good English lesson, and I'm ready.
That is nice. Thank you very much. Ivana Чернюта.
Good evening. We speak about our weekend. Yes. My weekend was fine. I had day off on Sunday. I visited my aunt and uncle. They live in a village. I have rest. I helped them in the garden. We picked vegetables. We picked tomatoes, cucumbers. Yes, cucumbers. So I have a nice day. Today I am wet. The weather is very hot. Now I am in English lesson.
Okay, that is nice. Thank you very much. Анна Нікуліна.
Good evening, my dear colleagues. I'm glad to see you. My weekend have been normal enough. Together with my husband, I was in a village in my grandfather. Today I feel empty because my favorite relative situated in emergency department. It's all today. Thanks.
Okay, thank you. I hope that
Thanks.
your relative will recover very soon and everything will be
Thank
okay.
you very much. Thank you.
Мар'яна.
Good evening. My weekend was nice as I went for a walk to ocean first time and relaxed and did some homework and housework. The weather is hot and wet in my city. My mood is nice and I'm calm now. That's all.
Okay, thank you. Людмила Мельник.
So, okay, about my weekend. My weekend was calm and relaxed. I went for a walk. I read and watched a film. About my mood today is patient and only patient. I went for a walk, and today I came back home and tried to study English with you.
Thank you.
Thank you very much.
Наталія Мороз.
Hello, I am very glad to see and listen all of you. My weekend was very hard because I visited my relative and I helped them. We walked in the garden and gathered vegetables and food. Now I'm driving a car and studying English.
Okay, so be very careful with driving a car. I'll ask you later.
Okay.
Thank you. Олена Маркова. Okay, Олександра Мисюра.
Misura, good evening. I have one free day. It was Sunday. This was a lazy day. I spent this day with my husband. We went for a walk. We talked about our future plans. We went to restaurants. In the evening, we watched TV.
And that's all, yes? Alexandra, can you hear me? Okay. Then Anna Limont.
Okay, so my weekend was so lazy and full of harmony and relax, and it is good, but it is so boring maybe. But today it was first day of my practice, and I'm so happy that I was with those people, because the people that work in those hospital in Bucha, they are so kind and smart, and when these people do the same work, this atmosphere, and I'm so happy to be here. Maybe it is first впечатление.
Impression.
Maybe it is my first impression is wrong, because it is only first day, but I hope this is true, and these people really are like I see them.
Okay, and how was the party?
This sugary. Я правильно зрозуміла відділення?
No, how was the party that you prepared for your...
This is yes, this party was very good, but it is a family party. It is not noisy, шумный, noisy.
Yes, yes.
Not a noisy event. It is so quiet and about peace. So
Okay, that's nice. Really happy for that. Thank you, Anna.
thank you.
Tetiana Horina.
Good evening. I did not have holiday because I have summer vacation, and every day I spend for relax and rest. Right now I'm visiting to my parents and my grandmother. I have grandmother, she is 100, and she is very happy to see me, and I very happy to see all of them. I am at home. My mood is good, weather is fine. I am rest.
That is very, very nice. Really cool. And how is your granny? Is she like healthy? Is she can talk? Yes, understand everything, or she has...
Talk, understand, but she move is bad. Your leg is ill and pain, but but she пізнає all everybody. She know that it's me, my brother, my daughter, my husband.
Okay, that's nice. That's really cool. That's amazing.
Thank you.
Thank you, Tetiana. Анастасія, Запорожець.
Yes, I'm here. In the weekend I go home in the Vinnytsia. I help my parents in the garden, and we work in the garden. It's all my weekend. But now I have a good mood.
Okay, that's good. Thank you very much. Oksana Довгаль.
Good evening. My mood is good. I went shopping on my weekend. walked with my friend and think about our holiday in the future. I try to eat a lot of fruits and vegetables now and relax as I can, and try to speak with my friends in different parts of Ukraine, and try to speak and to calm them. And that's all.
Okay, thank you. Thank you very much. And Tetiana Kasyanenko.
Hello, my mood is good. It was ordinary weekend with a trip from the city and walk in the garden with relatives. I think it was boring.
Okay, thanks a lot. And Victoria Doni. I can't hear you, Victoria, unfortunately. No, your microphone is on, but maybe some problems with your earphones. Can't hear you, unfortunately. No, I can't hear. You can write in our chat. And okay, so Irena, don't see your surname, so we can just say Irena. Can you hear me or no?
Yes, I hear you.
Your surname, please remind me.
Hishchuk.
Hishchuk.
Hishchuk, yes.
Okay, so just a few words about you.
My mood is very good, and my weekend was traditional. At Saturday, I cleaned my home and cooked, and on Sunday, I rest. I went to the church. I had usually spiritual rest and spent time with my family.
Okay, thank you very much. So now we can start our lesson. On the previous time, we spoke about the digestive system, different organs of the digestive system, and some possible problems or disorders that we can have with this system of our body. And also, I'd ask you to prepare some information, just general information about the appendicitis. What is that and why it can be so dangerous for your patient? Before we start, discuss your before you start introducing your thoughts and ideas, let's read this short this short message on some website where the patient asks for the advice. Dr. Diane. So let's read it and discuss. And do you agree with this treatment that Dr. Diane suggests or no? Let's start reading from the first paragraph. Mariana, can you read, please?
Dear Dr. Diane, I've had persistent pains for 2 days. At first, this was a dull stomach pain. Lately, the pain has become sharpened. I'm a little stressed out because of family and work. Friends say it might be an ulcer. Is it serious? Painful in PA.
PA.
Continue.
Okay, no, enough, thank you. And next one, Olena Markova, can you read this paragraph? The answer of Dr. Dayan. No, okay. Olena Kachanova.
Painful in PA. Dear painful in PA. Always take persistent pains seriously. Persistent pain could mean an ulcer. Pain between the heart and stomach might mean an esophagus problem. Pain lower in the abdomen could mean appendicitis. The appendix is between the small intestine and large intestine. It sometimes becomes inflamed and causes real problems. It's part of the digestive system, but its function is unknown, and it can be removed without any consequences. Later, go on.
No. Yes. Okay, you can read this because it's small.
Your doctor may want to perform a colonoscopy that will check your colon and intestines for any serious problems.
Okay, so as you can see, we have a picture of the digestive system: esophagus, stomach, large intestine, small intestine, and ulcer. What is that? So, and this doctor described different kinds of pain and different diseases. So tell me, please, do you agree with the doctor or no? Is she right in differentiating diseases or no? What's your opinion? Людмила Мельник. Ludmila?
Yes, I'm here. I dull stomach pain. Lately, the pain has become sharper, a little stressed out because. Okay, and dull stomach pain, це загрудинний? Dull stomach.
Dull це є тупий.
Dull stomach pain, and this pain started before after stress. Yes. No,
yes.
I think it can dull stomach pain. Stomach pain. No, I think it can be different. Not. I think should look something else. I mean, not only abdominal, not only digestive system. I think something else because was stress, and after that patient had stomach pain. Interesting. I think I think should see more maybe symptoms and ask many questions. For example, temperature, the other symptoms, because only one pain.
It's not enough. It's not enough.
Yes, it's not enough.
Okay, then thank you. Anna Nikulina, what's your opinion? Do you agree with Dr. Dayan, or would you like to suggest your?
Thank you. I don't have agree with Dr. Dayan because Dr. Dayan think about problems with esophagus, maybe gastroesophageal reflux diseases, and this patient has local pain in a low part of abdomen. Low part of abdomen, and I don't see information about right or left. If this situation, local acute ache or pain in right lower abdomen department, this situation is associated with acute appendicitis. Maybe first symptom of acute appendicitis names Kohera-Volkovich symptoms. In this situation, first local pain occur in epigastrium, and after 2 hours, this pain irradiation has irradiation on the right lower abdomen department. Another situation, I have opinion about method of diagnosis. This Dr. Diane, and prescribe method names colonoscopy. In this situation is very invasive method, and this method we don't administer in this situation. Maybe maybe in this situation we may prescribe method names X-ray, and at this method we may see symptom free air in abdomen. Maybe this symptom form differential diagnosis with peptic ulcer, and complication of peptic ulcer names perforation. Maybe for differential diagnosis we may prescribe X-ray method for with another types diseases names acute intestinal deficiency, and if situation we can use X-ray method, we may see pathognomic symptom names Kapp's Cloibera.
Okay, that's very interesting.
Thank you.
Thank you for your opinion. That is really cool. Any others? Any other ideas? Oksana Довголь.
I'm here. I think in this case we need more examination, another examination. It's like ultrasound examination, and to do general blood test and biochemistry test, blood test, and then we should think about some diagnosis.
Okay, thank you. So that's true. You are right that that it's really difficult to like to say the diagnosis because we don't have enough tests, enough examinations. So it's just like general information. I think that this information that the doctor wrote, the patient can find on the internet. Okay, and now I would like you to do this exercise. You should match the word with the correct definition. Esophagus, digestive system, stomach, appendicitis, or colonoscopy. So let's read the definition and say what is that. Ivanka, can you be the first one?
Yes, a pouch-like organ between the esophagus and the small intestine. It is stomach.
Thank you. Next one, Irina Heshchuk.
condition where the appendix becomes inflamed. It is appendicitis.
Thank you. Victoria, can you answer number C, letter C?
A muscular tube. Do you hear me?
Yes, yes.
Yeah, also, yes, good. A muscular tube connecting the mouth to the stomach, esophagus.
Very nice.
Esophagus.
Христина Кухарчук, D.
A medical procedure which examines the inside of the colon, colonoscopy. Colonoscopy. I don't know.
Colonoscopy.
Colonoscopy.
Good. Thanks. And the last one, Alexandra.
A system of organs which process food, nutrition and waste, digestive system.
Okay, so on the previous time, of the digestive system, we speak about like gastritis, ulcers, yes, some cancers, appendicitis, and many other. So I would like to speak about the gastritis. How can you explain the meaning of this disease? What is that, Olena Kalinina?
Explain about what, please? Sorry.
Explain about the gastritis.
Gastritis. Gastritis, this is diseases when patient feel pain in area, stomach area, and have this dysfunction digestive system, like vomiting and maybe rvota.
Yes, vomiting, sometimes temperature, pain, really sharp pain.
This is depend with запалення. Це буде inflammation, stomach слизистий.
Слизова, маєте на увазі?
Так.
Yes, mucus membrane.
Mucus, stomach mucus. All.
Yes, so to be honest, there are different symptoms. It can be nausea, vomiting, sometimes indigestion, yes, appetite loss, and of course pain. Pain is in the upper part of the abdomen. Okay, we have two phrases: acute gastritis and chronic gastritis. What is the difference between them?
Acute, maybe це гострий, загострий.
Yes, acute, it's the gastritis that occurs suddenly, той, який раптово виникає, так? А от chronic – це той, який поступово, тобто він є хронічним і він виникає поступово. Там, наприклад, щомісяця є приступи, там, чи щотижня і так далі. Тобто це не раптове виникнення. Окей, thank you very much. And chronic gastritis. What are the reasons of the gastritis, and can be the stress? Can the stress be a reason for gastritis? What do you think about it, Olga Novakovska? What's your opinion?
Maybe it's some problems with digestive system. Also, it can be not regular or some unhealthy food. Also, it possible it's some stress situation when this stress is often. So also we can it can be like a reason of gastritis. Also, for example, in psychosomatics, it's some emotions of enemy, some bad negative emotions also can be the reason of some problems with the stomach and with like gastritis. But maybe one of the main, it's something about food habits and our ecology also, and unhealthy and very heavy food, maybe fat food, like this.
Yes. Okay. Thank you very much. And now one more question for us students. Tell me, please, how can the gastritis be diagnosed? How can we get to know that our patient has this disease? Tetiana Kasyanenko.
The main method of diagnosis of gastritis is gastroscopy or esophagastroskopy. During this method, we can see mucus of esophagus, of stomach, and part of small intestine, and we can test mucus and test for main reason of chronic gastritis is infection, Helicobacter pylori. And after this exam, we can describe a method of treatment.
Choose
method of treatment. Usually it will be elimination therapy for Helicobacter pylori infection.
Okay, thank you. And should we follow any diet when we have the gastritis, when we try to treat this disease, or no? Tetiana Horina.
Yes, we must prescribe for patient diet. It's food can be fresh to cook, and smooth consistency, and this food was not consist conservation and color, barvник, да? Color буде правильно.
Different colorings.
Yes. And also the patient can eat food small portion, and about однакові the same interval of in day. In day.
You should have fixed time of
Fixed
having
time
milk.
day.
Okay, and is it possible to treat this disease, or we can just like we can just like to help the person to fight with this pain and with these symptoms, but can it be treated for 100%? Чи може бути вилікуваний гастрит на всі 100%, чи ні? Анастасія, Запорожець.
I think about yes, because when patient дотримується follow from therapy and maybe no, I don't know because не знаю, що зараз сказати.
Окей. Іванна Чернюта, what's your opinion?
As for me, I think the patients with gastritis can be treated, but after that, people should follow diet without hot food, without spicy food, and people should remember that gastritis can be повернутися.
Can be back?
Can be back, yes.
Okay, thank you for your opinion. And now we are going to speak about the appendicitis. So I would like you to watch a short video about this, and after that you will tell me maybe some additional points that you prepared. Just a second, I'm going to share my screen.
The appendix is the little one-ended tube that's attached to the cecum of the large intestine. Sometimes it's called the vermiform appendix, where vermiform means worm shape. So that should paint a pretty clear picture of what it looks like. And this odd kind of cute little worm-like structure's function is actually unknown, though some theories suggest that it might be a safe house for gut flora, and some evidence seems to suggest that it plays a part in the lymphatic and immune system. Other, arguably more cynical viewpoints think that it's just a useless vestigial organ from our ancestors. Whatever the case may be, the fact remains that it's pretty talented at getting inflamed and causing abdominal pain, a condition known as appendicitis. As much as 10% of the population develops appendicitis at some point, and it's the most common surgical emergency of the abdomen. Since the appendix is a hollow tube, the most common cause of inflammation is something getting stuck in or obstructing that tube, like a fecalith, which is a hardened lump of fecal matter that finds its way into the lumen of the appendix and wedges itself there. It can also be other things, though, like seeds that weren't digested, or even pinworm infections, which are intestinal parasites. Another cause of the obstruction, especially in children and adolescents, is lymphoid follicle growth, also known as lymphoid hyperplasia. Lymphoid follicles are dense collections of lymphocytes that get to their maximum size in the appendix during adolescence. Sometimes this growth, though, can literally obstruct the tube. Also, when exposed to viral infections like adenovirus, measles, or even immunizations, the immune system ramps up and these follicles can grow as well. Whatever the cause of the obstruction is, now the appendix is plugged up, right? Well, the intestinal lumen, including the appendix, is always secreting mucus and fluids from its mucosa to keep pathogens from entering the bloodstream and also keep the tissue moist. Even when it's plugged, the appendix just keeps secreting as usual. When this happens, fluid and mucus builds up, which increases the pressure in the appendix. Just like when you fill up a water balloon, it gets bigger and physically pushes on the afferent visceral nerve fibers nearby, causing abdominal pain. Along with that, the flora and bacteria in the gut are now trapped, right? And intestinal bacteria that are usually kept in check in the gut, like E. coli and Bacteroides fragilis, are now free to multiply. And this causes the immune system to call up white blood cells, and pus starts to accumulate in the appendix. This activation of the immune system can be seen in the lab as an increase in the serum white blood cell count. Patients might also develop a fever in response to the infection, which in combination with right lower quadrant abdominal pain at the point roughly where the appendix is, known as the McBurney's point, is a super important sign for identifying appendicitis. Also, along with the fever, other classic symptoms include nausea and vomiting. Now, if that obstruction persists, the pressure in the appendix increases even more. At a certain point, as the pressure keeps going and it continues to swell up, it pushes and compresses the small blood vessels that supply the appendix with blood and oxygen. Without oxygen, the cells in the walls of the appendix become ischemic and eventually die. Since these cells were responsible for secreting mucus and keeping bacteria out, now the growing colony of bacteria can invade the wall of the appendix. As more cells die, the appendiceal wall becomes weaker and weaker, and for a small proportion of patients, it gets weaker to the point where the appendix ruptures. Rupture of an infected appendix allows the bacteria to escape the appendix and get into the peritoneum. And patients often experience peritonitis with rebound tenderness, meaning pain when pressure is taken off, again, around the McBurney's point. Patients might also have some abdominal guarding, where the abdominal muscles tense up when pressed to try and avoid pain. The most common complication with a ruptured appendix is pus and fluid getting out and forming an abscess around the appendix, called a paraappendiceal abscess. Sometimes subphrenic abscesses might also form, and these would be tiny abscesses below the diaphragm but above the liver or the spleen. The standard treatment for appendicitis is appendectomy, which is a surgical removal of the appendix along with antibiotics. If patients have abscesses, these are also important to surgically drain. Removing the appendix isn't known to have any negative side effects, and sometimes it's removed if the surgeons are already doing an abdominal surgery for some other reason, just to avoid an appendicitis down the road.
Okay, so now I have a few questions for you. So tell me, please, what is the appendicitis and why it is so dangerous for our organism, and why should we be very, very quick when the patient has got acute appendicitis? Olena Karenina, what can you say about it? Okay, Olena can't say. Anna Limont?
Okay, so the appendicitis, it is inflammation of the vestigial procession, and we have to treat this quick how we can, because it can cure the parappendicitis abscess and this vesicle it can to crack,
Can be cracked.
fracture, and all what все, що було всередині.
Everything that was inside.
Inside in this vesicle can потрапити.
Spread, поширитись, spread.
Spread, дякую. To spread into abdominal порожнина, господи. Cavity. Дякую.
Okay, thank you. So, what are the first signs, symptoms of the appendicitis? This question is for Alexandra.
It can be nausea, vomiting, fever, or pain in lower right quadrant of the abdomen.
Okay, thank you. Mariana, do you know any other symptoms?
No, pain, abdominal pain, nausea, vomiting, the high temperature. First began with nausea and at abdominal pain in central part abdominals, then спускається вниз, як сказати?
Goes down.
Як перше слово?
Goes.
Goes down the right lower abdomen part, and the pain acute. That's all. Everything. Це все, що я знаю.
That's all. Okay, thank you. And now, okay, but what if we are not sure for 100%? Can the blood test show us does the patient have appendicitis or no? Olena Kachanova.
I would like to add any symptoms. Very often, pain begins around the navel and then often shifts to the low right abdomen at first, and then pain maybe worsen if patient coughs, walks, and makes other joint movements. And sometimes it connects with constipation or diarrhea, and sometimes abdominal bloating and flatulence meteorism. And other score is around the laboratory signs. For example, YCC, white cells count may be raised, and shift of VCC to left, and other symptoms. And there are total score 10 balls for acute appendicitis if we have some symptoms. There is 8 symptoms. Some has 1 ball, and some 2 have 2 balls.
Points.
Points. I'm sorry, points. Right iliac fossa tenderness 2 points, and raised white cell count 2 points. but symptoms 1. If we have 4 on the 5 points, it's compatible with the acute appendicitis. If we have 7 or 8 points, indicates a probably appendicitis. And if we have 9, 10 points, it's very probable. Maybe it's all, but are you listening to me?
Yes, yes, of course. Yes, I hear. Okay. Okay.
Sometimes I'm sorry. Sometimes acute appendicitis maybe connect with inflammation of ureters, right ureters. So we could analysis of urina, and it may be positive symptoms of acute appendicitis to inflammation of ureter, right ureter.
Yes, yes, that is true. And sometimes when you have some like problems with kidney, or when you have a stone in kidney, sometimes you can also have really disgusting, a really strong pain, sharp pain, and also vomiting and fever, or when you have some problems with kidneys. So
yes,
yes, so that's why we should be very, very attentive when we have the patient with this symptoms, and we should be very quickly, because if it's appendicitis, we should work and we should do everything very, very quickly, because it can cost their life. So that's why. Okay, so that's all about appendicitis, and now I would like to speak with you on some different points about the family. Let's back to general English, just relax a little bit, and explain me the difference between a word father and parent. What is the difference? Ivanka, can you explain me?
Father is only one from parents. It's dad. Yes, a parents. It's mother and father. Oh no.
Yes, father, it's male person. Yes, it's only one, and parent can be a father and a mother. Very nice. Okay, what about mother and stepmother? Christina?
Mother is woman, яка народила, was born child, and a stepmother it's не рідна мама, це мачуха.
Yes, okay.
Я не знаю, як пояснити чесно по-англійськи.
So, mother is the person who gives you a birth.
Yes.
And stepmother, it can be your father's wife. Okay, next one. Brother and brother-in-law. Ольга Новаковська.
Вибачте, а можна питання? А у нас на екрані щось крутиться, немає зображення. Чи це так повинно бути?
Ви нічого не бачите?
Я бачу, у нас все добре.
Все добре.
Все добре, так, все добре, бачимо.
Можливо, у вас просто проблеми з інтернетом, інколи таке буває. Або спробуйте перезайти. Okay, so
maybe brother, it's a man who have same mother and father, and brother-in-law it's a person who have only mother, for example, the same mother and different father. Maybe this.
No. Any other ideas?
What does it mean, brother-in-law?
So I will explain.
Maybe it's a brother, wife.
Yes.
Husband.
Husband, sister.
A brother-in-law, no, brother-in-law is the brother of your husband or wife or your sister's husband. So in-law, we add this part of the word when we have new relationship during someone's marriage. Коли в нас виникають якісь нові родинні зв'язки через одруження. Припустимо, ваша сестра чи брат одружується, так, і у вас з'являється brother-in-law, mother-in-law, father-in-law, sister-in-law. Тобто оце in-law, грубо кажучи, кажуть у законі. Тобто по закону, тобто через одруження, офіційне одруження, у вас з'являються нові родичі. І вони всі додаються до ось цих типу sister, brother, grandmother, in-law. Все ось те, що виникає через шлюб, буде in-law. Нові родичі. In-law. For example, your husband's parents are your parents-in-law. Your husband's sister is your sister-in-law. So, in this case. Anna Nikulina, a step-sister and half-sister.
A step-sister and half-sister. Half-sister, this synoptic sister maybe. And step-sister, I think that sister who is daughter, new wife, father.
It's easier to say it's like step-sister is a daughter of your stepmother or stepfather.
New wife, yes, stepmother.
Yes. And half-sister, it's a sister who shares one parent. Like you have one common parent, one mother or one father. Одного спільного родича, тобто батька або матір. Next one, adopted child and or only child. Ірина Гещук.
An adopted child, an only child. I don't know.
Can I help?
Yes, of course.
An adopted child, it's a child, for example, from some дитячі будинки.
Yes. That is true.
I don't know how it's in English. So it's a child who haven't, whose parents refused from this child, and this child give some new family, and it's adopted child, and an only child, it's only one child in family.
It is like the orphan. This adopted child can be orphan, тобто він може бути сиротою. Or it's called orphan house or something like this, тобто дитячі будинки. Yes, that is the child that becomes a part of your family and which wasn't born in your family. So it's like adopted. And only child, yes, you are right in this case. And we missed grandfather and great-grandfather. Tetiana Kostyuk. Do you know what is the difference grandfather and great-grandfather?
Father, это, ну,
Grandfather.
grandfather – это дідусь.
Yes. But explain in English. Стараємось пояснювати англійською, наскільки це можливо.
The grandfather is dead father.
Yes, it's dad or mom's father. Okay. And what about great grandfather?
The great grandfather is dead grandfather.
Yes, dad's or mom's grandfather. You are right, Tatiana. Well done. What about brothers and sister and siblings? What is this? No, that's not for you, not for you, Christina.
Brothers and this when in family is 2 and more son parents have, and sister when in family have father and mother have 2 and more daughter girls. And siblings, it's when in parents have son and girl.
No.
Хлопчик, брати і сестри разом, я так зрозуміла.
Двоюродні, виходить.
Тоді помагайте, будь ласка.
Maybe the same brother and sister are siblings.
Ти і сестри, brothers and sisters, це правильно. А siblings, хто тоді siblings?
Двоюродні, да, сестра і брат.
This is first line of relatives. First line of relatives in genetics. First line of relatives. Brother and sister of the first line of relatives.
Yes, that is true. That is siblings. So brothers and sisters and siblings, they are the same. Це є однаково. Дуже часто бувають такі моменти, коли людина не хоче казати, хто в неї, чи брат, чи сестра, і вона каже, yes, I have 2 siblings.
Я маю типа когось, виходить, так?
Так, тобто в мене є 2, тобто або братів, або сестер, я вам не кажу кого. Тобто це більш формальний варіант. Деякі люди вважають це, наприклад, неприйнятною інформацією, не хочуть про це розповідати. І загалом не зовсім коректно питати якісь такі речі. Тому вони можуть сказати, I have 2 siblings in my family. Тобто у мене в сім'ї є ще, окрім мене, 2, припустимо, дітей. 2 siblings. Бо найчастіше siblings якраз для братів і сестер застосовується. Тому вони кажуть просто siblings, коли ви не хочете уточнювати, хто саме. Чи брат, чи сестра, чи 2 сестри.
Дякую. Thank you.
Okay, and now immediate family and extended family. Anna Nikulina.
It's very interesting. Sentences. I think that immediate family, this family, our parents, extended family, this is our new family after marriage.
From marriage.
Marriage.
That is very interesting and logical explanation, but no, that's not true. Людмила Мельник.
Immediate family, it's family, mother, father, and their children. And extended family, this all family. Father, mother, their children, grandparents, cousin, big family.
Yes. It's cousins, aunts, uncles, grandparents. Second cousins, yes, that is extended family. Immediate family, it's the closest people, mother, father, brother, sister, and that's all. So this is the immediate family. Okay, that's nice, very good, thank you. And now we have just a few words in the family tree. So tell me, please, how do we call a man that you get married with? Alexandra, how do we call a man that you got married with?
Husband.
Got married to, sorry, got married to. Husband. And who are you for your husband, Alexandra?
Wife.
Wife, very nice, okay. And who is, okay, your brother's daughter is your Victoria Doni. Who is your brother's sister for you?
My brother's sister.
Uh-huh.
My sisters. My siblings.
Okay. Who is your brother's daughter for you, Mariana?
Ньюфас, по-моєму, племінниця.
No.
Niece.
Niece, okay. Natalia Moros, who is your sister's son for you?
Nephew.
Nephew. Okay, that is very good. Thank you. And now let's continue. So now we are going to read a short story about the life of man and about his relatives. So let's start reading, and after that we'll discuss some unfamiliar words for you. So let's start. Tatiana Kasyanenko, can you read the first paragraph?
My father died when I was 9, and so my mother was a widow with 4 young children. She remarried 5 years later, so now I have a stepfather. As he is not my real father, I call him by his first name, which is Dieter. I've got an elder brother called Thomas and 2 younger sisters, Anya and Claudia, who are twins. We are a close family. My mother is an only child, but I've got 2 uncles on my father's side. One is married with 2 children, and the other is married with 3 children. So altogether, I have 5 cousins. I get on well with Uncle Rolf, and he always tells me I am his favorite nephew. Of his nieces, I think he liked Anya best. Recently, my brother Thomas got married. His wife's name is Sabine, so I now have a sister-in-law as well.
Okay, thanks a lot. So, what does it mean, widow? What does it mean, widow? You have some hints on the screen. Yes, it's a woman who lost her husband. Victoria Doni, how can you explain the phrase get on well with?
Get on well with, it's to be in good relationship. Get on, like good friendship, make friends and be relatives.
Yes, be relatives.
Understand each other good.
That you easily can find common language.
Yeah.
Okay, and one more question for you girls. Tell me, please, how can we say in English одружитися з?
Get married on.
No.
Get married with. Get married with.
No. Any other
to
idea?
Be.
Repeat, please. Повторіть.
Get married.
Get married. Добре, get married, це зрозуміло. А я хочу сказати, я одружилася з, там, не знаю, з кимось. Або я одружилася зі своїм чоловіком, хай буде. Там 3 роки.
I married with my husband 3 years ago. I married.
Get
Добре,
married.
тепер get married, правильно, фраза get married, одружитися. А якщо я хочу сказати я одружена, то ми кажемо I am married. А якщо хочемо сказати я одружилася з, ніколи не кажемо with, тому що це є груба помилка. Ми кажемо I got married to. To. I got married to. I got married to my husband 3 years ago. Got married to. Це дуже-дуже важливо. Got married to. Тому що це не страшно. Це дуже часто робиться така with, бо ми собі з українською робимо аналогію, проводимо і кажемо with. Це нормально. Але правильно казати to. Get married to. Get married to. Okay, so now I would like to ask you a few questions about your family. So tell me, please. We have different questions, but remember one thing, that sometimes you won't answer on these questions. Бувають такі моменти, коли є запитання, на які ви не хочете відповідати, і це нормально. Тому ви можете їм дуже увічливо і сказати I'm sorry, but I'd rather not talk about that. Але я б не хотіла говорити про це. Бувають різні люди, бувають різні моменти і різні запитання. Тому ви використовуєте цю фразу, ви можете побачити в себе тут на екрані, вона є останній рядочок. I'm sorry, I'd rather not to talk about that. Вибачте, я б не хотіла про це говорити. І все. І на цьому крапка. І повірте, вас більше ніхто не буде щось допитувати. Особливо за кордоном. Тобто, I'm sorry, I'd rather not talk about that. So now I'm going to ask you some questions and you will choose. Do you want to answer or no? So you have options. Please, Людмила Мельник, choose a person.
Okay. Калинина Елена.
Okay, now choose a question, Людмила.
Елена, do you have a big family?
Not, I have not a big family.
That's all, Victoria?
No, you can ask some other question. Olena.
I asked or
No. We have 3 questions. Yeah, 2 questions. Do you have a big family? Who do you live with?
Okay. Can you ask me, please, who do you live with?
I'm alone.
Okay. Okay. And do you have
Що ви хочете запитати?
Да я думаю, знаєте, щоб так не було, щоб мені людина не сказала I'm sorry.
Ні, це нормально.
Я просто або I'd rather not to talk about that. That I think information that okay. Could you tell me about do you have sibling?
Yes, I have many relatives, my sibling. This is
siblings, тільки брат і сестра. Ми використовуємо
siblings. I have brother.
Okay, thank you. Then Olena, choose a question and choose a person.
I choose Victoria Doni.
Okay. Which question?
Okay, then ask a question.
Yes. Do you have a big family, Victoria?
I have not big family. I have only 2 children, my husband, but I have Maybe it's big family, yes. I have two sisters. Yeah, I have two sisters. They have child, and my mother and father. Our close family is big.
Oh,
Child. They have child or children?
Children.
Children.
Sorry.
Do you have niece or nephews?
Yes, I have niece and nephew, but unfortunately they are from Russia, and now we lost each other because they said that Putin, good man. We have some problem when this was started. I can't understand them and they can't understand. We can't understand each other. Now we hate each other.
Yes.
You can't find common language, unfortunately. It's a very
Unfortunately, yeah.
It's very popular problem, to be honest. So
I can't understand why my relatives don't want know we alive or no. Anyone's ask, where are you? How are you? It's impossible to understand this situation.
yes,
Yeah.
yes. There are a lot of similar cases. I have a lot of friends who have got the same problem. So it's not their relatives, their daughters, their parents. So it's really difficult. I don't understand how it can be.
I understand why they people. Someone was born in Ukraine and lived in Ukraine a lot of times, a lot of years, but now they think that Russia is good, but Ukraine is bad. Why? For me, it's like monster. They are like
I
not
think
people.
yes. I think that nobody knows. Nobody
Yeah.
knows, and nobody can explain it, unfortunately.
Unfortunately.
Victoria, choose a person.
Yeah. Okay. I choose Людмила Melnik.
Yes, I'm here.
I would like ask, have a meal with your family? How often do you have a meal with your family?
How often?
Do you have meal
Unfortunately,
with
at
your
the last time I see my family hardly ever because
Why?
I'm in Kyiv and my children in Khmelnytsky region because I think that it's more reliable for them at first, and my husband is military and he is in Odessa. That's why in this moment I alone in Kyiv.
Alone, yeah.
Mhm.
Okay, I understand. How often do you?
No. Let's choose another. Let's choose another person. Okay. Another one. Anna Limond.
Так, я запитую, так?
Yes, please.
Окей. Христина Кухарчук. Я ж обираю людину, так?
Yes.
Добре. Христина Кухарчук, ви мене чуєте?
Yes, I'm here.
Okay. Does your family get together for any holidays? Maybe Easter, Christmas, New Year?
I know some. I wasn't my family in holiday because вони живуть далеко.
I understand.
They
They live
far from me.
far from me. Yes, thank you.
Thank you.
Okay, Христина, choose a person.
1 minute. Оксана Довгаль.
Thank you.
Oksana, tell me please, do you spend more of your free time with family or friends, and why?
I live alone.
Oksana, sorry.
You have some problems, Oksana, with the internet connection.
And what about now?
Now it's better.
Do you hear me? Yes.
Yes.
I live alone, so more of my time, my free time, I spend with my friends, but not with my family, because they are far from me.
Okay, thank you.
Okay. So, girls, what are you going to do for next time? I send you a link for studying new vocabulary about the family. And I would like you to write like the short description of your family. Just a few words like my family, like my extended or my immediate family is big, not big. I have a lot of brothers, siblings. In this case, 10 sentences. 10 sentences will be enough. For example, how do you spend your free time? Maybe now you don't spend time together, but before the war, we every weekend we went to the restaurant or went to the cinema or have family dinner or had family dinner, something like this. Please write this short description of your family and send it to my email. Надсилаєте одразу мені на email 10 речень коротенько про свою сім'ю і вчите новий вокабуляр. Наступного уроку ми продовжуємо з вами говорити про digestive systems disorders, про наступні проблеми і захворювання травної системи. So I wish you to peaceful evening, to nice evening, and I hope that if your family and your relatives are far from you, that in very short time you'll see and you'll be together with them. So that's my wish for the end of this lesson. See you on Wednesday.
Thank you very much.
Bye.
Bye.
Bye. Bye. Bye. Bye. Bye.
Bye.
Вікторія, маєте хвилинку?
Yes.
Скажіть, будь ласка, ви сказали на імейл.
Я
не знаю, чи ви кидали. Добре.
Я все скину. Я
Дуже
скину
дякую.
в документі, там буде посилання на мій імейл.
Добре. А ще скажіть, будь ласка, у нас випало одне заняття, чи буде це якось
Ні,
посеред тижня?
воно додається вам до загального курсу. Там, тобто не переживайте, в нас ведеться рахунок, він буде. Просто курс продовжується на один день пізніше.
Я зрозуміла. Добре, дуже дякую вам. До побачення, гарного вечора.
Thank you.